Hey guys, Dr. St. Jean here. In this video we're going to discuss 3 simple exercises that you can do really in the comfort of your own home or your office that are going to help alleviate back pain that you might be dealing with right now. Now each one of these exercises is going to help improve your range of motion, improve the overall flexibility of your spine, and they should also help decrease some of your pain. But please try to remember when you're watching this video, it's always going to be better for you to first determine what types of movements, what types of stretches, exercises, etc. will actually benefit your back in terms of pain reduction before doing them, right? So, for example, if you have too much flexibility, let's say you're a professional dancer, right? Super flexible, then it might not be beneficial for you to stretch as much as it would be to undergo stability and strengthening exercises. And the way for you to figure this out is to undergo a comprehensive evaluation or an exam. So just keep that kind of in the back of your head and your mind, that not all these recommendations really apply to everyone. They're more general. Another important point to make is that really with anything in life, but especially when it comes to rehabbing the back, repetition's key. So save this video, put it somewhere safe, maybe in your favorites, so you can kind of reference it over time. And the more you practice these movements, the more effective they'll become, the more likely you'll be doing them right, and just the easier it will be to implement overall. So let's talk about the first one, the prone press up. I'd say about 80 to 90% of back pain patients that we see here in the clinic have pain that stems from their lower back region posturally remaining in excessive flexion for prolonged periods of time. Think sitting in their car all the time, at their desk, on their couch. The injury or pain that starts to develop is often a result of constantly slumping forward. And like I said, sitting for prolonged periods of time, or even in certain instances, bending forward to pick up something really heavy, or even more common, something just light off the ground can cause these types of injuries. So I'm not going to get into the mechanism here because that's not really the topic of this video, but just remember when you place the spine, especially the lower back or the lumbar spine, in excessive flexion, or when you're leaning forward or sitting, you're really stressing out a ton of important structures in and around that area. And eventually over time, they'll give way, they'll get tired, and that can potentially lead to the development of pain and injury. And here I kind of drew out the lower portion of your spine. You can see the green is the discs, and you have the vertebral bodies, and what happens is when there's excessive flexion or forward bending, you can put a little bit too much pressure in the front portion of the disc, and that increases the likelihood of pushing the disc back out to the spinal column. That's herniated discs, or creating any kind of degenerative changes in the area, so not good. With that said, when you stretch your back in the opposite direction, meaning away from flexion, into extension, that often diminishes your back pain. And some refer to this as a stretch. I like to refer to it as more of an exercise. But I had to talk about it because it's just a really, really potent technique in terms of reducing back pain, especially flexion-induced back pain. A good way to implement this is to try it on your floor. While, let's say, you're watching TV or reading a book. You're going to start by lying on your stomach on the floor, and then just kind of hang out there, lie there for 15 to 30 seconds. Just allow your body, your musculoskeletal tissues to adjust to the new position. And then get up on your elbows, and notice that when you do this, you're kind of increasing the curve in your lower back. And that's, again, called extension. And that's the movement in this exercise we're trying to induce or create more of. So eventually, after you've been kind of maintaining that position on your elbows for a little bit, then you're going to put your hands below your shoulders, like you're going into a push-up, like you're setting up for a push-up. Now, the key here is that you're not going to push-up. So instead of pushing up off the ground and lifting your pelvis off the ground as well, keep your pelvis locked down. I mean, it's got to be on the ground like it was almost glued there, while you push off and up with your hands. And that is called the prone press-up exercise, and it's really just extremely potent in terms of pain relief when it comes to back pain, especially when it's caused by flexion injuries. So try doing about 10 reps up and down, and continue to do that every hour if you can. The next stretch is called cat camel. And actually most people have probably heard of this or probably familiar with it, especially if you do yoga. There's really endless variations to this exercise, and most of them are viable options, but I'm going to describe it and teach you in regards to rehab, and also specifically how to decrease back pain. So you're going to get on all fours, And what I mean by that is your hands are going to be under your shoulders and your knees are going to fall directly into your hips. So kind of to orientate yourself in this position, just kind of visualize or think that you're going to oscillate between looking like a cat and looking like a camel, hence the name. Makes sense. But once you're in this position, I want you to relax your head and allow it to kind of drop down. Round your back up towards the ceiling until you feel a nice stretch in your upper, your middle, and your lower back. And then hold that stretch for as long as it feels comfortable in that position, or for about 15 to 30 seconds. After that, you're going to return to the starting position and go back into that neutral spine where you're on all fours. The next portion of it is you're going to sway your back by pressing your belly towards the floor and lifting your buttocks towards the ceiling. And again, this exercise you're going to hold for as long as it feels comfortable, or for about 15 to 30 seconds. Remember though, if it starts to cause pain, then just don't do it. As simple as that. But you're going from cat to camel, and over and over again. The last exercise I don't really have a name for. I don't know if I'd even really consider it an exercise, but it's relevant because it really makes you feel better. Basically, you're going to lay on your back and you're going to bend your knees to a 90-degree angle with your feet together. And you're going to start to gently kind of rotate the hips back and forth on the ground. If both directions feel good, great. Then continue to rock from side to side. If only one direction feels good, then that's fine too. Just stick in that direction. The key point is to obviously not aggravate your pain. You don't want to do that. You only want to move in the directions that relieve the pain in the case of this exercise. So there you have it, 3 very general but yet effective exercises that you can do at home or in the office that should help to reduce your back pain. I'll say it one more time. If you're suffering from back pain, you really want to see a practitioner that specializes in back pain. It'd be a great idea. You won't get 100% better until you figure out what is actually causing the pain in the first place. So for more exciting information on how you can improve your health, click the link below to access more of my free health-related information, things like articles and videos and more. Or you can click the link and sign up for your new patient comprehensive exam. This is Dr. St. Jean. Be well and see you soon. Bye-bye.